Welcome back for another Medvarsity Deep Dive. Going through all the medical case discussions that you all sent over, I was really struck by just how challenging DVT and orthostatic hypotension can be following a spinal cord injury. So today we're going to do a deep dive into these two complications, what they are, why they matter, and what we can do about them.
Yeah, it's fascinating, isn't it, these two conditions? While seemingly distinct, they often end up intertwined during the whole recovery process.
Absolutely. And they can be pretty scary, especially for someone already dealing with the impact of a spinal cord injury. Let's start with DVT, or deep vein thrombosis. I think most people have heard of it, but maybe not the specifics.
Right. It's basically a blood clot that forms in a deep vein, usually in the legs. And the real danger is if that clot breaks free and travels to the lungs, causing a pulmonary embolism. That can be life-threatening.
Okay, so that explains why it's so important to catch it early. But what makes someone with a spinal cord injury more susceptible to DVT in the first place?
Well, immobility is a huge factor. When you're not moving around, blood flow slows down and can pool in your veins. Think of it like a still pond. Things tend to settle and stagnate. And this slower, stagnant blood flow creates the perfect environment for clots to form.
So in a way,
Yeah,
it's like the circulatory system's version of use it or lose it, right?
exactly. And there's another piece to this puzzle. You see, the temperature of the blood also plays a role. Cooler blood is more likely to clot. And for someone with a spinal cord injury, especially in the early stages, temperature regulation can be a challenge.
I'm picturing someone in those early days after an injury, lying in a hospital bed, maybe struggling to stay warm. It's almost like a perfect storm for DVT to develop.
It really can be. That's why we have to be so vigilant, particularly during the acute and subacute phases after injury. Waiting for symptoms to appear is just too risky because by then it might be too late.
Okay, so we know why it's a concern. But what are the warning signs? What should people be looking out for?
Well, the classic signs of DVT are swelling, pain, and tenderness in the affected leg. You might also see some discoloration of the skin, and the leg might feel warmer to the touch. But the tricky part is that sometimes these symptoms can be subtle or even absent, especially in the early stages.
It sounds like prevention is key. What can be done to lower the risk of DVT in the first place?
We have a whole arsenal of strategies, and the key is a multi-pronged approach. Even simple things like ankle pumps, flexing your feet up and down can help keep the blood flowing. And there are devices like pneumatic compression boots that can mimic that pumping action.
And I imagine those compression stockings we often see people wearing play a role too.
Absolutely. Compression stockings are a mainstay for both prevention and early management of DVT. They provide gentle pressure that helps to improve blood flow and reduce that pooling we talked about.
It's all about keeping things moving literally. Now, I know medications are often part of the picture too, right?
Yeah. Yes, for patients considered high risk, especially those with a history of clotting or other medical conditions. We often prescribe anticoagulants. These are medications that help prevent clots from forming. Low molecular weight heparin is a common one.
It sounds like there's a real emphasis on starting these interventions early on.
Absolutely. The sooner we address the risk of DVT, the better the chances of preventing serious complications.
Okay, so we've talked about the silent threat of DVT. Now let's shift gears to something a bit more. Well, gravity-related. Orthostatic hypotension. We all feel a little lightheaded sometimes when we stand up too quickly, but it sounds like this is a whole different ballgame.
You're right. With orthostatic hypotension, we're talking about a significant drop in blood pressure. When someone moves from lying down to sitting or standing,
And what's going on in the body to cause that?
essentially gravity pulls blood down to the lower extremities. And for some people, especially after a spinal cord injury, the body struggles to compensate. The blood vessels don't constrict quickly enough to push the blood back up to the brain, and that leads to a sudden drop in blood pressure.
So paint a picture for me. What does it actually feel like to experience this?
Now, imagine you're finally able to sit up. After spending days or even weeks in bed, instead of feeling that sense of progress, you suddenly feel dizzy and lightheaded, like the room is spinning, your vision might blur, and you might feel incredibly weak and fatigued.
Ugh, that sounds awful. And I imagine it could be really frightening, especially if you're already dealing with the physical and emotional challenges of a spinal cord injury.
Absolutely. It can be very disorienting and even scary in some cases. People might even faint.
Yeah.
Which can obviously be dangerous.
Okay, so we definitely want to avoid this if possible. What can be done to manage orthostatic hypotension?
Fortunately, there are a number of approaches we can take. It often starts with non-pharmacological measures, things we can do without relying on medications. One of the simplest yet most effective strategies is avoiding sudden changes in posture. Instead of jumping out of bed, take your time, sit up slowly, dangle your feet for a few minutes, and then stand up gradually.
It's almost like giving your body a heads up, right? Hey, gravity's about to kick in. Be prepared.
Exactly. And it's not just about getting out of bed. It's about being mindful of any time you're changing positions, whether it's going from sitting to standing, or even just bending over to pick something up.
Makes sense. Are there any other lifestyle modifications that can help?
There are a few things we often recommend. Avoiding hot baths or showers is important because the heat can dilate your blood vessels and contribute to a drop in blood pressure.
So maybe opt for a lukewarm shower instead of a steaming hot one.
Exactly. And it's also wise to be mindful of certain medications that can have blood pressure lowering effects if you're taking any medications. Talk to your doctor to see if they might be contributing to your symptoms.
It's all about being aware of those potential triggers and making adjustments where you can. But what about more proactive strategies? Are there specific rehabilitation techniques that can help manage orthostatic hypotension?
Absolutely. Physical therapists and occupational therapists can play a key role here. One technique that can be really helpful is incorporating a head-up tilt during sleep. By elevating the head of the bed slightly, it helps gradually acclimate the body to being upright.
Interesting. So it's almost like a slow and steady approach to gravity training.
Exactly. And there are other things we might recommend, like increasing salt intake. I know we often hear about the importance of limiting salt, but in this case, a little extra salt can actually be helpful because it helps the body retain fluids and increase blood volume.
So it's not always about restricting salt, especially in this context.
Right. And of course, frequent position changes are crucial. It's all about promoting circulation and preventing blood from pooling in the lower extremities. We might also recommend using elastic stockings, thigh cuffs, or abdominal binders to help support blood flow.
It sounds like a multi-pronged approach is key here, combining lifestyle adjustments with targeted therapies.
Precisely. And if these non-pharmacological methods aren't enough to manage orthostatic hypotension, we can consider medication.
Okay, let's talk about those medication options. What are some of the commonly prescribed drugs for this condition?
One that's often used is midodrine. It helps constrict blood vessels, which in turn raises blood pressure. The dosage varies, but it's usually somewhere between 2.5 and 10 milligrams, taken a couple of times a day. Your doctor will determine the best dose for you.
Are there any potential side effects we should be aware of with midodrine?
Yes. It's important to be aware that higher doses can sometimes lead to high blood pressure when lying down. It can also cause goosebumps, which can be a bit annoying for some people.
Okay, good to know. What other medication options are there?
Another medication we might consider is fludrocortisone. It helps the body retain salt and water, which again increases blood volume and raises blood pressure. The typical dosage is 0.1 to 0.4 milligrams daily.
And any side effects to watch out for with that one?
The main ones with fludrocortisone are low potassium levels and swelling. Regular monitoring is important to make sure these side effects are managed effectively.
It seems like managing orthostatic hypotension effectively requires a careful assessment of the individual's needs and a tailored approach that might involve lifestyle modifications, rehabilitation techniques, and possibly medications.
You've hit the nail on the head. It's about finding the right combination of strategies for each person.
We've covered a lot of ground today, from the silent thread of DVT to the gravity challenge of orthostatic hypotension. But one thing that strikes me is how interconnected these two conditions are.
That's a great point. They both really underscore the significant impact that immobility can have on the body, particularly the cardiovascular system. It highlights the importance of a holistic approach to rehabilitation after a spinal cord injury.
Absolutely. It's not just about addressing the immediate physical injury. It's about supporting the body's overall recovery and resilience.
Couldn't agree more. And that's why open communication with your healthcare team is so vital. Be proactive. Share any symptoms or concerns you have. And don't hesitate to ask questions.
It's all about being an active participant in your own recovery journey.
Exactly. Knowledge is empowering. The more you understand about your body and the potential challenges you might face, the better equipped you'll be to advocate for yourself and navigate the path to recovery.
We focus on the physical challenges of DVT and orthostatic hypotension today. But I'm curious about the psychological impact of these conditions. How might they affect a person's recovery journey and overall well-being?
That's a really insightful question, and one that often gets overlooked. Imagine dealing with the physical limitations of a spinal cord injury. and then facing these additional complications. It can be incredibly disheartening.
It's like taking 2 steps forward and then getting knocked back again.
Exactly. It can impact a person's motivation, their sense of hope, even their belief in their ability to recover. Some people might start to withdraw socially, isolate themselves, or even experience symptoms of anxiety and depression.
It makes you realize that healing is about so much more than just the physical body.
Absolutely. It's about the whole person, their physical well-being, their emotional resilience, their social connections, their sense of purpose and identity.
So what can be done to support someone who might be struggling with the psychological impact of these conditions?
First and foremost, it's about acknowledging that these challenges exist and validating those feelings. It's important for healthcare providers, family members, and friends to be empathetic and supportive. Encouraging open communication is key.
Creating a safe space for someone to share their fears and frustrations without judgment.
Exactly. And beyond that, there are a lot of resources available, like support groups and counseling services that can help people process their emotions and develop coping strategies. Sometimes simply connecting with others who understand what they're going through can make a world of difference.
It's a reminder that no one has to go through this alone. There's a whole community of support out there.
Absolutely. And it's important to remember that even though these complications can be setbacks, they don't have to define a person's recovery journey.
It's about focusing on what you can control, celebrating small victories, and never losing sight of your goals. Well, I think we've covered a lot of ground today. We've delved into the complexities of DVT and orthostatic hypotension, explored the physical and psychological challenges they present, and highlighted the importance of a holistic approach to recovery.
It's been a fascinating discussion, and I hope it's empowered our listeners to be more informed and proactive in their healthcare journeys.
As always, we encourage you to continue learning and stay engaged in your healthcare. And remember, knowledge is power. The more you understand about your body and the potential challenges you might face, the better equipped you'll be to advocate for yourself and navigate the path to recovery.
Well said.
Thank you for joining us on this Medvarsity Deep Dive. Until next time, stay curious and stay well.